Hello, everyone. Today's topic for our group is going to be bronchitis, and this presentation is by James Amy, which is me, Brianna Davis, and Michelle Sibley. So, what's the etiology of bronchitis? So, it's inflammation of the lower respiratory tract caused by either a virus or bacterial infection. Um, but typically, the triggers of bronchitis include pollution, dust, chemicals, smoking, sinusitis, and asthma. Basically, anything that irritates your respiratory tract. The people who are most susceptible to bronchitis are going to be smokers, young children, elderly, and higher occurrences occur during the winter with bronchitis. And smokers, the reason why they're susceptible is they're introducing an irritant into their bronchioles and trachea, and that causes inflammation. The pathophysiology regarding bronchitis is going to be the airway becomes inflamed and narrowed due to capillary dilation, infiltration of the inflammatory cells, which is like your macrophages and eosinophils, increased mucus production, loss of ciliated function, which is, if you remember your ciliated epithelium, they actually project um, stuff and clear your airways out. They have like a wave motion, and it works your mucus up in your respiratory tract. So that way you can cough it out. And the clinical manifestations of bronchitis, the subjective ones, are going to be sore throat, fatigue, chest pain, muscle aches, and headache. And the objective manifestations are going to be cough, fever, dyspnea, and hoarseness. And then some diagnostic tests that we can do to determine if the patient has bronchitis is basically clinical assessment. So if they have a cough greater than 3 weeks, and that's one of the signs of bronchitis, and they can have either clear, crackled, or wheezes on expiration, so exhaling. And to determine whether this is bronchitis as well is normal. It's going to be normal on a chest X-ray. So if it's the chest X-ray comes back positive, it's going to be pneumonia. So it's that fluid accumulation in the lungs. And bronchitis does not have that fluid accumulation in the lungs, and that's what separates it from pneumonia. And then also sputum culture. So people who have bronchitis, they're going to have either a productive or non-productive cough. And if they have a productive cough, we want to take a sputum culture just so we can assess whether it's what's the cause. And if there is bacteria present, what can we do to treat it and identify that bacteria, and then prescribe the correct antibiotics for it. And then we have medical treatment. So this includes bronchodilators, which opens up your airways and allows you to breathe and helps airway clearance. And then cough suppressant, because if you're coughing constantly, it's going to cause pain, agitation, and you're not going to be able to breathe as effectively as you can. And then expectorants are used to clear your airways from that excessive mucus production. And then antibiotics, kill the bacteria, depending on which type of bacteria it is, and that's why we use the sputum culture to determine which type of antibiotics are most effective. And then also analgesics for pain, and then antipyretics if there is an infection occurring, or if they have a fever, you just want to bring that fever down. And then non-pharmacological treatment, you want to use a humidifier or vaporizer, and that helps relieve congestion, so that way it can help airway clearance and effective breathing patterns. And then you want to increase fluid intake. The more water you bring into your system, the more it loosens up those thick mucus secretions and helps you better project it and cough it up. And then obviously avoid smoking. You don't want to add any more irritants into your system and further exacerbate your condition. And then Brianna is going to discuss the nursing diagnosis.
Hello, I'm Brianna Davis. I'm going to be talking about the nursing diagnoses. Our first nursing diagnosis that we came up with was impaired gas exchange related to inflammation of the bronchi and trachea. Our second nursing diagnosis was ineffective airway clearance related to excessive thickened mucus secretions. The third nursing diagnosis we came up with was ineffective breathing patterns related to bronchoconstriction and excess mucus production. The fourth nursing diagnosis was activity intolerance related to insufficiency of ventilation and oxygenation. The potential complications from bronchitis is pneumonia, and this is due to a fluid accumulation in the lungs. Typically, with bronchitis, viruses and mycoplasma bacteria can inhibit the macrophages and lymphocytes and cause a secondary bacterial invasion. The other complication of bronchitis is often seen in children, where the bronchitis develops into throat, and this is due to the airway proportion to body size, and it's due to the smaller lumen and vessel wall. And for your patient teaching, what we're going to want to do is to teach our patients, those who do smoke, that we want them to stop smoking for the time being while their bronchitis is giving them problems, and maybe educate them on the use of a nicotine patch, because smoking does irritate the respiratory tract. The second thing we're going to want to teach our patients is deep breathing and coughing techniques. For deep breathing, we're going to inhale deep and slow through our nose and expand our rib cage and letting the abdominal move forward. We're going to hold this breath for 3 to 5 seconds and breathe out slowly through pursed lips. And we're going to do this 10 times, preferably every hour, and we will want to encourage our patients to do so. The third one was going to be pursed lip breathing, and honestly, I didn't know what pursed lip breathing was. So, for pursed lip breathing, you're going to inhale through your nose and exhale through tightly closed lips. You're going to want to avoid individuals that are sick. So if, they have bronchitis and they know somebody who has the flu, they might want to just kind of stay away and keep isolated from them. We're also going to want to educate the patient on the importance on vaccinations, especially the influenza and the pneumococcal vaccinations. And we're going to want to tell our patient to avoid cold, dry air. And there's our references. Thanks, guys.